Welcome, everyone. We are definitely trying out a new option today, and I'm really grateful to those on my staff and our awesome media partners for helping us get this going. So I am coming to you live from a media room inside the Department of Health here in Crosse County. And I'm grateful to be with you and to be able to do this in a new way, keeping everyone as safe and healthy as possible. So thank you to all that helped us do that. I'm Jen Rombalski. I'm the director of the Crosse County Health Department. And as we typically do with these briefings 3 times a week, I will give you an update on case numbers in Crosse County as well as the state. I'll give you some updates and then we will take questions. A quick shout out that tomorrow is my oldest son's 17th birthday. And since we can't do anything super special, I thought maybe I'd give him a shout out here in case he's watching. So happy birthday, Gabe. I want to start then with case numbers in the state of Wisconsin. So at present time, we have 2,756 positive cases. That is an increase from yesterday of 178, pretty consistent increases that we're seeing each day from the state of Wisconsin numbers. Total negative cases in the state of Wisconsin at present are 30,115 cases. That is an increase of 1,603 cases from yesterday. And that puts our positive to negative, so of all of the tests, the percent that are positive in the state level is 8.4%. There are 790 individuals in our state hospitalized. That is an increase of 45 from yesterday, and a total of 29% of positive cases that are hospitalized. And we have 99 who have passed away from COVID-19 in our state. That is an increase of 7 from yesterday. In Crosse County, we have just 1 new case to report. That brings our total of cases up to 24. That individual is a male in his early 50s and is experiencing mild to moderate symptoms. We continue to have 17 who have recovered of our total 24 cases. So that is a wonderful number to see that have recovered already from this virus. We have 0 hospitalized relating to COVID-19 and 0 deaths in the county of La Crosse. So I just want to mention that comparison with the number of negative cases at the state level, La Crosse County's is currently at 976, and that is from the Department of Health Services website. And that is 2.4% of all of our cases that are being tested are positive in La Crosse County, comparing that to the 8.4% at the state level. So we continue to be significantly lower for positive cases, and we're grateful for that here in La Crosse County. The next thing I want to talk about is call center. So we have a call center that remains on site here. We are making that call center virtual. It will become staffed remotely, and we will continue to operate that next week, Monday through Friday, 8 to 4:30. But this week, because of the holiday, we are not going to be staffing the call center on Friday, and we will not be staffing the center on Saturday morning. So the center will not be open Friday or Saturday. However, the number, which is 785-6240, will continue to be operational, and we'll have a message on there for you. The message will allow you to leave a voicemail, and we will get back to you. And then the message will indicate that if you have questions in particular about your exposure or your risk level or the need to be tested, there is a state call center that is available, and that is really operated through a website, and I'll give you that web address now. It is www.wihealthconnect.com. So that is a website that you can go to. We will have that on our website as well, and it will talk you through your potential. It will ask for information, and then that will be placed into a queue for risk levels, and you will get a call back based upon your willingness to receive a call back and your risk level with the information that you share. So there are certainly will remain resources available to you over the weekend. That call center is actually staffed 24/7 through that website. Beyond the call center, then, we want to talk about Easter. Easter is coming up, and we just experienced Palm Sunday, and we have an Easter holiday coming up on Friday. Some of us will continue to be available and working to assure that we are monitoring and tracking cases, but we will try to have as many in our community at home as possible that are on the holiday. And this is a time where we have to just reiterate the need for all of us to be home and to not be out doing shopping for things other than what we deem essential. So if we think about some of the traditional practices around Easter, many people practice Easter egg hunts, for example. And if you look in your supplies and decide that you do not have an Easter egg basket or enough Easter eggs to put candy in, or the candy to put in the eggs, the baskets and the eggs are not considered items that you should be doing travel for. So we would ask that you not go out to get items specific to anything that is not essential. So we think essential really is groceries and food, and also medicines and healthcare provider visits after calling first. So we just want to reiterate, though that is difficult to maintain and wanting to continue your traditions, if you can get creative with things around the house and not have to go and get supplies that you find that you don't have at this point, we please ask you not to go out and do shopping for those items that are not essential. So one of the things that we've been asked is what to expect in the coming weeks. And in particular, individuals in our community are wondering about cases. There are a number of models out there that relate to when we might see this peak of cases at the nation level, in the state. And those models vary pretty significantly. I think at this point, we need to stay the course with our safer at home practices and our social distancing practices. So I just cannot explain enough how critical it is right now, even more so over a holiday weekend, when we can forget how important it is to stay home and continue the practices that we have talked about for a long time. It's hard to be patient, but we ask you please to stay home, to not go out with the exception for essential travel, to not take your family with you on those outings. We want you to be washing your hands frequently and continuing to try really hard not to touch your face. All of these things are making a difference. It is keeping our case levels down in La Crosse County. And until we see that official peak, we have to stay the course. And if we see that in the next couple of weeks, we will certainly be talking about that as we continue forward here. But we definitely need to stay the course, or we will see a surge in cases. So at any time, if we as a community are not doing the practices that we need to be doing, we will see an increase of cases. It is inevitable that will happen because of the way that the virus spreads. So we are keeping that down because we are not congregating and we are maintaining those social distancing and hand washing practices. So thank you to all of you who are currently doing that. It is just wonderful to know how everyone is working really hard to stay together or to work together to keep us moving forward and keeping case numbers low. So in addition to reiterating the need for social distancing, I also want to just remind all of us that this disease, this virus does not discriminate. We cannot discriminate either. It's so important to remember that anyone of any color, of any background, of any ability or disability can get this virus, and that we should not be looking at certain individuals in our community in a way that is stigmatizing. So please remember that when you're out and about, you might see groups of people. There will be some that are non-compliant with the messages that we've asked to be doing. There are practices in place to assure that we can address that. So please be kind to one another, and I just ask that we really just work together. So with that, I think I just want to mention that going forward, because of the Easter holiday, we will not have a media briefing on Friday. I'm going to really miss you guys. So we will be back here on Monday. We will put out a press release with any new information that you would normally get from us in these briefings. But just to assure that everyone can be home as much as possible, we won't do the media briefing on Friday. So it will be next Monday when I will see you again. So at this time, I will take questions.
Hello, Jen. This is Justin from WKBT. My first question for you is, graphs like the one being updated by the Wisconsin Department of Health show the cumulative total of COVID-19 cases. However, wouldn't it be a little bit more accurate to also factor in who has recovered and the deaths to see how the spread is changing?
Yeah, Justin, great question. You're right. It does tell more of a picture if we have more than just the positive cases, because it helps us understand how many people are actually being tested. So when we only have positive cases, for example, in Crosse County compared to Wisconsin, we can see that of those that are being tested in Crosse County, we have a much lower percentage of those that end up being positive. So you're right, additional numbers can help tell more of the picture, but none of them even all together tell the entire picture. So you're right, I think it would be helpful if there were more numbers available.
I guess kind of going off that as well, with the food delivery and pickup system still seems to be pretty popular in our area for the county, I should say. Are there any recommendations for what people should do if they order food delivery to minimize the chance of them picking up the virus too?
So Justin, if you're speaking specifically about takeout and not groceries, but really I don't know if it matters for either one. I think really it is that particularly with takeout, there are lots of practices in place with restaurants that are providing that service. And we definitely feel that that is safe for individuals to be eating takeout. With groceries, if we're using online pickup for groceries, if someone feels uncomfortable with the groceries they're receiving, not knowing if an individual who packed them for them might have symptoms, again, we're really working hard with our local businesses to assure that they are doing active monitoring and they are helping their employees to stay home if they are not well. But there is the potential that there could be somebody who might have symptoms and not realize that they could be spreading the virus, or they don't have symptoms. And we know that a number of individuals can spread the virus without having symptoms. I think if you pick up your groceries and you make sure that you're not touching your face, that you are washing your hands before eating, after touching the groceries, that you sanitize the surfaces after you unpack the groceries, maybe you wipe down canned goods and things like that. I think that would be exceedingly cautionary, and you certainly could take those practices.
This is Drew from WIZM. Would you suggest, with all the different varying models and the different information as far as when the peak might actually come, are these models and kind of graphs that people should even be really concerned about at this point? Is it more the local information that you're providing that is kind of the most important as far as what people should do behavior-wise?
Yeah, thanks, Drew. That's a good question. I do think that, what happens is if we see a model, let's just say we see a model and it says April 15th, we should peak. Then after April 15th, we might have a false sense of security in terms of our risk levels. So a peak just means that we are no longer seeing the case numbers go up at the same rate as they had in the past. It doesn't mean that we won't see additional numbers. And in fact, we will continue to see cases. If you think about a bell curve, the shape of that curve is, at the top is the peak. How long it has taken us to get to that peak is about how long it will take us to come down from that peak. So the risk remains even if the peak happens to come. So it's fine that individuals look at those models if it helps them to understand what's happening, but do understand that it is only a model. It can be different than that. We have to stay flexible in our thinking. This is a virus that we're trying to predict, and really only the virus knows what it's going to do. So we need to continue to do what we have in our ability, which is the social distancing practices, the hand washing, the not touching our face. Those will be the ongoing continuous messages, because that's what we can do to prevent the spread of this disease. We can't control other things, we can control that. So that's what I would like individuals to cling to, is what we can control to keep the spread of this virus down.
Jen, Travis from WXOW here. We're seeing some things out there about quinine and zinc sort of maybe being able to boost your immune system. Can you touch on, maybe the sort of recommendations you have on that, or if these are things that are true or not?
So Travis, that's a great question. Unfortunately, I don't have a lot of information without looking that up. So ways to boost your immune system, I think really it comes back to having a healthy diet, getting enough sleep, reducing your stress or controlling your stress in a healthy way, not using substances in inappropriate ways, and being outside, and that can help reduce your stress. Exercise can help reduce your stress. Those are the fail-safe methods to help boost our immune systems and keep us healthy. So these other things are not necessarily the ideal. And while some may think they help, and maybe there is even some evidence that they do, I think the fail-safe methods come back to the ones that we know really well.
Hello again, Jen. This is Justin from WKBT. If you wouldn't mind, can you just repeat the question after I read it here? What is the best fabric to use when making your own face covering?
So the question is that the best fabric to use when making your own face covering, and thank you for calling it a face covering and not a mask. We're trying really hard to use that language so that we're not confusing with the masks that our healthcare workers need to be able to protect themselves, taking care of those that are actually ill. The type of material that we really recommend is cotton, but it should be 100% cotton, and it should be tightly woven. So if you hold up that fabric to the light, you should not be able to see through the fabric. That tells you that it is a tightly woven fabric, and it should be cotton.
Drew again from WIZM. You mentioned ways to boost the immune system. Is there evidence that the coronavirus is like all these other viruses, that having a healthy immune system will at least lessen the symptoms or not have a higher likelihood of catching the disease in the first place?
Yeah, good question, Drew. So the question is, if we are using these fail-safe methods to boost our immune system, do we know that that will help reduce the chances of getting this virus? So I think that we don't know everything about this virus. We've talked about that before, but just knowing how our immune system works is that if it is at optimal functioning, that the way the immune system works to decrease the virus and to reduce the symptoms, that it will be able to operate more quickly, more effectively in combating the virus. And so I think having a healthy, optimal immune system will help to decrease either the length of time that you're sick or the severity of the symptoms. Obviously, you're still going to get sick because your immune system has to actually be exposed to something before it can fight it off.
Jen, we're getting some questions on Facebook about social distancing. And if we see people who aren't social distancing in the community, who do we direct to fix that? Yeah,
so the question is, if we see individuals in the community that are congregating, really what we want to do is, first of all, we want to be kind. It might be difficult to some in the community may want to, give their opinion to that group. I think if we can do that in a kind way and you feel that that's safe for you to do, that could be a nice community communication that we have. However, I think the ideal situation is that if you see that, really this is a safer at home order. We are not allowed to congregate in groups. We should be at home. So the non-emergency dispatch line is the number to call. And if someone is available to go out and respond to that situation, just like anything else that we're concerned about in our community, that's the same mechanism, is that we contact our law enforcement officers.
Hey, Jen, Travis from WXOW here again. Minnesota just extended their stay-at-home order. Do you expect Wisconsin to do this as well? And is that something that you would like Wisconsin to do?
Yeah, thanks, Travis. So in terms of the extension of the safer at home order, I do fully anticipate, I'm preparing for that safer at home order to be extended. Ours currently goes until April 24th, I believe, and I think Minnesota extended theirs to May 4th, so it's not significantly longer than ours currently is. But again, it will depend upon how case numbers continue to look. We are nowhere near being out of the woods with this virus, and so I think we need to continue what we're doing that's working to keep case numbers down. Because if we let off of it too soon, we risk having a resurgence of cases, and then at some point the spread gets so overwhelming that we are not able to get control of it again. So I think we just need to be really careful about the timing of that. And I don't envy anyone who has to make the decision about how long that should go, but I do anticipate that it will likely be extended.
Hello, Jen. Justin again from WKBT. Kind of going off of when this will all end, I guess, it's been a few weeks now, but what would be considered the end of the pandemic where the risk is low enough to be able to more or less kind of get back to our normal day-to-day lives rather than this safer at home order?
Yeah, that's an interesting question. Many of us, I think, are wondering when will normal come back to us, and I think it is going to be a difficult balance to know when can we go back to normal activities compared to the safer at home order. So know that just as we ramped up to the safer at home order in increments, we're going to see the same thing happen when we come down from this situation. So even when we decide at the state level that there will no longer need to be a safer at home order, we will still be asked to do our best to social distance, to keep group numbers low until we have, very few cases, and then we are able to really, come back into a normal reference before COVID-19 came upon us. But I do encourage us as best we can. I know this is difficult every day that continues. I see in my own family members the challenge with remaining patient, with making good decisions, even those that I, in my social circles, I see things that people aren't meaning to do. They think they're complying and they're really not. So I find that I have to address things in other areas as well. But patience has to be something we continue to try to maintain, because we remember that we want to keep this low, this curve low, and that means longer as opposed to short and really peaking strongly. And that is because we don't want to see our healthcare systems be overwhelmed and not be able to take care of those that are sick. We're doing really well with that. That doesn't mean let's go back to normal really quickly. That means keep going with what we're doing, what's working. And I think the hardest part with that is just balancing our own patience levels and remembering that this is working and we need to continue what we're doing. And even when we see that peak happen, and even when we see the safer at home order be removed, we still are going to need to follow all of these same practices of maintaining distance and washing our hands frequently and not touching our face and not being in groups, particularly large groups. So it's going to be a while before normal is really experienced again. But I think we're still, even though it's challenging, we're in a really good place. Remember, we do not have deaths in our county. We have only had 2 individuals who needed to be hospitalized and are no longer hospitalized relating to COVID-19. So we are doing really well here. And I think in the midst of all of this disruption in our lives, we have to continue to try to see where the positives are and where the opportunities are here. And we have means to communicate with each other that are electronic. We have people who have recovered from this illness in our county. So as best we can, we have to help each other try to see those positives and opportunities.
Jen, there's been some questions about the Meals on Wheels programs and making sure those who are homebound get the nutritional value that they kind of rely on. Do you have any information on that and kind of how those programs are still running, or any tips on how people can make sure that people elderly are taken care of?
Yeah, so how are the elderly being taken care of and what's going on with the Meals on Wheels programs? So that is a program that is operated out of the Human Services Department with the, wow, I just cannot think of it all of a sudden. ADRC. I just can't think of what the Aging and Disability Resource Center. Sorry, guys. So the Aging and Disability Resource Center is working those Meals on Wheels sites. We do still want to see individuals be able to get the meals that they need because that is part of maintaining their health, just as all of us when we need to go out and do essential travel to get our groceries. So I don't have an exact current status on it, but I can check on that and report back.
Jen, we've seen a few animals now, such as tigers, come down with COVID-19 as mosquito season sort of comes around here and temperatures warm up. Is there anything people should be worried about as far as mosquitoes maybe possibly carrying COVID-19?
Yep, so the question about mosquitoes potentially carrying COVID-19. At this point, the state has looked at that question and does not feel that that is a risk where mosquitoes might be able to carry the virus or spread the virus. So we believe that that is not a risk at this time, but I can tell you it will continue to be monitored.
Do we have any other questions for Jen today? Okay.
Thanks, everyone. Have a wonderful holiday weekend. Be safe.